He works as a public health specialist to a local funding agency for the Global Fund. In 1991, Dr. Sujata Samarakot won the gold medal for the MSc in community medicine. So on this night, where legends, living legends, stars, superstars, rising stars, and many other categories of wonderful public health families meeting, I invite on stage Dr. Sujata Samarakot. Ladies and gentlemen.
Thank you, Sandesh. Actually, Kapila, you can't say no to him. So when he invited me, I'm sorry to say it was not very willingly that I accepted. He kind of said, he took me by unawares. We are doing this, can you, I said, okay, I will accept. Right? So that's how Kapila works. Anyway, he's a go-getter, taskmaster, so he got the event done. And the purpose here is to navigate through this public health journey. We all know that wherever the policymakers, the politicians, all of you go, you all talk so highly of the public health gains. But public health gains were not just one person's effort. It's a multi-sectoral, multidisciplinary, multi-individuals' efforts. So we thought we'll call some of these experts. There are other experts also that we couldn't invite because Sri Lanka is called, I can remember the WHO representative Dr. Mehta used to tell me, Dr. Sujata, Sri Lanka is the lighthouse of public health and keep that lighthouse going. So this is a good event to keep that lighthouse going. And also, you know, Rome was not built in a day, and we have invited all of you to share these experiences. The policymakers like Dr. Mahipala will take us through all the experiences that he has had, and also people like Dr. Susi Pereira, Anil, all of them, Chitramal, especially with her experience in MCH, and there were so many past people in the MCH who took this challenge and took public health to its position today. So all of you all are there, especially the young people, to learn lessons, learning from what the other people have done, so that you all learn and take public health to get greater heights and make Sri Lanka this lighthouse to be burning all the time. Thank you very much.
Thank you, madam. I've been told by the person who's recording this event, if you come somewhere here, you will be recorded, not there. So anyway, I have now we go to our program proper. Some housekeeping rules for all of you. Please keep your phones on silent, and you may take photographs, take footage. You are free to do so, and share and give this event publicity. For the speakers, 2 minutes before your time is up, we will ring a bell, and we will try to stick to time because we have to wrap up this evening and enjoy all the food and fellowship as well. So the first item on the agenda is the evolution of overall health services in Sri Lanka. To tell the story of Sri Lanka's overall evolution of the health system, I have the pleasure of inviting a person who has done outstanding and unforgettable service to our nation, Dr. Palita Mahipala. He's an outstanding personality in the health services. He climbed to the professional ladder and reached the positions of Director General of Health Services and Secretary Health, and held prestigious posts in WHO as a representative in Pakistan. Dr. Palita Mahipala is probably one of the most well-known faces of public health in Sri Lanka, and every time we see him, we feel like we meet family. So it's my pleasure to invite you on stage after a very long time with us on an event like this. Ladies and gentlemen, Dr. Palita Mahipala. Please can we have his presentation as well? So, if you like, you can.
Thank you so much for the kind words of introduction. The President of the College of Community Physicians, past presidents, council members, members of the college, senior professors who are present here today, invited guests, colleagues and friends, ladies and gentlemen. I am deeply honored, truly humble, extremely pleased and absolutely delighted to be here, standing before you in this wonderful occasion to share some of my thoughts. Santusha was talking about rising stars, young stars. We have dying stars also. I don't know which category I belong to. Let me start with a small video. Can I have the video?
Video.
Video?
Yes, sir.
Ladies and gentlemen, old people don't stick to time. Sujata said, tell a story. Kapila wrote to me and said, talk about the evolution of health services. I was in a dilemma, what to tell, what to do, what to present. But let me see what I can share with you all in this short time period. One of the philosophers said, gratitude is the first, fairest blossom which spring from the soul. I have few or two extraordinary people who are mentors to me, Dr. Reggie Perra and Dr. Joe Fernando, I think maybe mentors to most of you all as well, who guided me and molded me to take up medical administration, so I have my great respect to them. And when we talk about the history, we have to talk about the people with whom we have moved forward. Colin Powell is a charismatic leader. He said, there are no secrets to success. It's the result of preparation, hard work, and learning from failures. It's very important. Abdul Kalam also said, don't look at the success stories, look at the failures and learn from failures. That is where you can learn more. I was the DMO Mathura. Those days we didn't have directors in base hospital. It was the biggest base hospital with 750 beds. Suddenly, I was the Morocco in Moish. I was called by Dr. Reggie Perra. We were about to start our postgraduate studies, myself and my wife. One day I got a call. We didn't have usual telephone services. We had to get the trunk call, and it is through the post office. If it is not working, we have to go to the police station to call. So I got a trunk call from the post office. It's from DDGMS, Ministry of Health, Dr. Reggie Perra. He called me and said, Mahi, you have to take up as the DMO Mathura. I never thought about that. I was just 32 years and having experienced 6 years as a medical officer of health in Morocco, one of the most remote areas. And I came home and told my wife, I got enough dose. Said, we are going to go for the postgraduate studies, what we are going to take and how can you manage. Is a bigger institution, biggest base hospital with 750 beds. So she gave enough facts for me to come and tell Dr. Reggie Perra that I am not going to accept it. So I didn't have the phone connection to the post office, so I went to police station. OIC was our good friend. I went there, got a call, and started, good evening, sir. The first word came, good evening, Mahi. I know you never let down me. I have nothing else to tell. So I said, sir, I have my wife in Morocco hospital. If I go to Matara, I have to get her to Matara. And he said, yes, that will happen. So that's how I took over medical administration and DMO Matara when I was just 32 years. All senior consultants, more than 20 were there. And anyway, somehow I managed. But then one day, he visited Matara Hospital and told me, there's a institute called Postgraduate Institute of Medicine. We were in the periphery, we never know these things. He said there's a course called Community Medicine, Masters. You apply for this. And you go to the Lake House bookshop and get a book called Park and Park and study it. So I follow him. I came to the PGIM with great difficulty from Mother, and then of course put application, went to Lake House bookshop, brought the Park and Park, put 1 week leave. Those days getting through a screening test is not easy. We had 196, only 16 selected. 20 for dental, 16 medical, and we have colleagues here also in the same group. So I got through the screening and started doing my MSc. And he came for lectures. One day he came for the lecture and said, now when you are going to submit your dissertation, I said in another 1 month's time. After the dissertation submission, you come and meet me. I came early morning. He used to come to the office by 7 o'clock. I came and met him. He said, now you have to take up administration. There's a vacancy in Hambantota RDHS. There's a SLS person is there. I am going to advertise it. You apply. That's how it started. So 1995, when I was just 35 years, I became a senior medical administrator in the Ministry of Health. Now, when I was the DMO Matara, I don't know, storytelling is not easy to control yourself. You know, you have so many things coming to your brain, and you start to tell it, and time goes and time moves on. And so I started transforming Matara Hospital. It was one of the worst hospitals when it comes to the healthcare delivery. So I started transforming the hospital, the staff, making them motivated. And my staff was Mrs. Denagama Sirivadana. She probably has gone and told her husband that there's a young DMO who is doing a lot of work. So he wanted to come and meet me. He is the chief editor of one of the leading newspaper, and he wrote a book about this personality, Professor Enaka Bibila. I have never met him, I have never seen him to my eyes, but I have read about his book. He came and gave a book with his signature, Doctor, this is only I can give for the work you are doing in Matara. So I went same day night, went through the book twice till morning. And since then I have read this book about 100 times or more than that. When I am down with something, I read the book. He is a person who learned much from failures and then of course make successes. He was the first pharmacology professor in Sri Lanka. He was the first pharmacology professor in Peradeniya University Medical College. He was the first dean in Peradeniya Medical Faculty. He was the first SPC chairman. He was the person who postulated this essential drug policy and so on and so forth. So he's a well-known character and you all know him, and he's my inspiring leader. Martin Luther King, who was assassinated in 1960s, who was against the human oppression and discrimination. He said, if you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. By all means, moving. Keep moving. And that really hit my mind. Success is nothing but keeping moving, but moving forward. Slowly or faster, moving forward. That's very important. So with that, WHO definition on health, WHO was started in 1946, put to force in 1948, started on member states. And the definition of health is state of complete physical, mental and social well-being, not merely absence of diseases. So it was a holistic approach, going beyond the usual biomedical definition on health. So well-being is a presence of positive emotions, is containment, happiness. So there's a spiritual dimension also, the satisfaction of life. And now people are talking much more about the wellness. And there are institutions, there are organizations, and wellness is which has the holistic approach to health and has the spiritual dimension as well. And that's very important because Sri Lanka has had this experience for a quite long time. So if you look at Sri Lanka as a case study, we had Ayurveda system focused on balance through diet, exercise and spiritual practices. Never focused on diseases, never focused on risk factors, but went on this. And then of course we have temple-centric village, Gawai, Dagabai, Gamai, Pansalai, and we link with the temple so much. The people were farmers, they engaged, exercise, working in the paddy fields, evening they go do meditation, spiritual things, and they didn't have much disease. They were content, they were happy. But now then of course we had the Portuguese time, 1505 introduced the Western biomedical system. Now we focus on diseases. So we have pluralistic healthcare system. We have indigenous, which is more than 2,500 years now. But of course, the Raj Soma Deva, the archaeological professors say our history goes beyond 50,000. The human civilization is the most longest is in Ethiopia, 100,000 years. Sri Lanka, Balamgoda Manavya is close to that now. So we probably has indigenous system much more than 2,500 years. Then of course Buddhism was introduced with that. Ayurveda system was introduced to Sri Lanka in 3rd century BC, then allopathy. We had very good lifestyle, the monastic way of life. And as I said, engage in physical activity, we had very good life. So the risk factors we are today talking about, NCDs, all were prevented at that time. So we have to go back. And wellness economy is a huge economy. Ladies and gentlemen, if you look at the global expenditure on health, it is $9.3 trillion, out of which 4 trillion spent by America, half goes on drains. 4 trillion by America, out of 9.3 trillion spent on health. And Sri Lanka, we spent 1 billion on health, dollars. And you look at the wellness has been focused. So 6.3 trillion, 60% of what we spent on health globally is spent on wellness now. It's a new concept coming up. So much, 1 trillion spent on healthy eating, physical activity, 1 trillion. So this is another area where we need to really think about. Let me quote few examples because time is so much limited. Disease elimination is a long journey. It's generations are working on that, not single person, but I was privileged, honored, and lucky to be the Director General Health Services when we eliminated 2 main diseases, the filariasis and malaria. Malaria, it is after 30 years a tropical country eliminated malaria, that was Sri Lanka. And we have Professor Rajitha here who has involved. I was chairing the steering committee, national steering committee. I remember we had the target, we wanted to eliminate malaria and filariasis by 2016, 2017, Sujata worked with us, PMTCT, the mother-to-child transmission, and then of course 2018 measles elimination. So I didn't want to go out from this track and target. So 2016, many said steering committee that still we don't have enough data. So are we too early to submit the dossier? But I said no. You know, when it comes to the business, I was, oh my God. So anyway, Sri Lanka was able to eliminate malaria and filariasis. I was part of it. And then of course I was involved with the bringing traffic light system to Sri Lanka, the first country in the entire Sierra. And then of course there are many other things. There are 2 programs very much close to me. Professor Lamavadu Surya is here, Thalassemia program. We started Thalassemia Council. We had Professor Weatherall, who wrote the prize test book, was one of the members, and Sir was there. And we had started Thalassemia program very vibrant way. And Vision 2020, I was the focal point for 20 years. And of course we have given 500,000 spectacles free of charge to the people, the school children. 80,000 cataracts we have done free of charge. And I remember this one of the very interesting journey. I started walk from east to west, the Batik Club East to Goldface. 178 miles, and there were one blind person also worked with me, and we were able to raise so much of funding for the Vision 2020 program. So health sector is not safe. If you look at Professor Lamabadu Surya, who is very much concerned about the statistics, is 1 in 1 million if you travel by air, there is involved. If you scuba driving, it is 1 in 100,000. Rock climbing, 1 in 1,000. Getting to hospital, 1 in 300. So getting to hospital is not safe at all. So therefore we started the quality assurance program. I don't want to go into detail, but we fought very hard, myself and Dr. Karandugoda, with World Bank to set up the quality secretariat, got funding for the building. And one meeting I remember, Dr. Ejipella as the secretary chairing, World Bank mission was there. They said they can't give money to the building. I said myself and Dr. Karandugoda, we were doing free consultancy for the World Bank for the quality assurance program in Sri Lanka. We both got up and said we are going to walk out. We don't want to do anything. Then they gave money, 30 million that time. So quality assurance is now much there. And we had the recently cabinet approval to start with the accreditation bureau as well. So policy is like, and health service is like, blind people touching elephant and telling, it's one is talking about the tail, other one of trunk and leg and all that. So we thought that we should have a guidance. So we came out with health policy, the second health policy, 2016-2025, approved by the cabinet, which gives the direction. So in Sri Lanka, we have demographic transition, we have all the transitions, you name it, we have it. And as a result, we need to really go for transformation. People are dying due to NCDs prematurely, so we need to have health sector reforms. After Almata, 50 years gone, but still 50% of the population not having access to quality, comprehensive healthcare services. So we need to go for primary healthcare reform, secondary and tertiary. We have worked with World Bank for the primary healthcare reform, got 45 billion rupees, and we worked with the ADB and got 30 billion for the reform. So I think my time is over, and we set up a think tank in Sri Lanka health sector. We had extraordinary, remarkable, outstanding people like Professor Lamabadu Surya, Dr. Palta Bekong working for SUSI was there. 25 people, experts in public health and others. The working Sudat was there. And think tank, we met every other week and came out with a proposal. And our idea was to ensure equity, effectiveness, efficiency, quality, sustainability and all that. Health is a fundamental right in Sri Lanka, but it should be a human right. So, history, we have a long history, started anti-malaria campaign in 1922. It took 94 years to eliminate malaria in Sri Lanka. So, we have set up campaigns. Most of these campaigns are set up as the first campaigns in the entire Southeast Asia region. And then, of course, legislation was there. Vaccination, you all know, Sir Edward Jenner found smallpox vaccination in 1796. Sri Lanka started vaccination in 1806, 10 years later, because we were British colony. And we have the oldest vaccination ordinance, and there are so many things. We have the first health unit. These are all stories where Rockefeller Foundation is involved in this. I have no time to tell. This is very important. Sri Lankan people fought for independence, and there was a huge public cry. The British government appointed Lord Donomo as with two other members as committee. We call Donomo Commission. They suggest the first reforms. It's a health reform, it's a social reform, it's an education reform. They recommended Governor General to declare Sri Lanka as a state of welfare. Free health, free education, nutrition, and sanitation set apart 12.5% of the GDP. And this is very important, universal franchisee, that's very important to ensure the equity. Because if somebody wants to come to the parliament, they have to work for the rural population. Earlier it was only the elite crowd who had the voting power. Because of this, we have developed rural health services in Sri Lanka. So a quite interesting story, but we have no time. Let me finally finish with a few quotes. And if somebody say can't, it's very easy. Drop T, this can. somebody say it's impossible, drop I am. So it's possible. So that's the transformation we have to go by impossible things to be possible, cannot things to be can, and transform. And now the entire global community is moving on value for the money, and we have to take risk. If there's no risk, there's no return. So Jack Ma, I wanted to tell a story about him. There's no time, but he said we appreciate yesterday, but we are looking for better tomorrow. So we need to moving forward. And he said, if you don't give up, still you have a chance. So don't give up at any time. If you give up, no chance. If you don't give up, you have a chance still. 3 times Olympic winner. No history has produced such a man. 100, 200 gold medal for 3 consecutive Olympics. He said, stop waiting for the things to happen. Make the things happen. Abraham Lincoln also said, don't wait and create the future you want. Make the things happen. And finally, a winner is a dreamer who never gives up. Thank you so much.
Ladies and gentlemen, I think another round of applause for the rising star of storytelling. Thank you very much, sir. We wish we could listen to you for a long time, but we are going to meet you again and recap about all this. So that was Dr. Palitha Mahipala. Next on the agenda,